We're going to talk about holding more of the bladder and how Botox can help you. When you do intermittent catheters, something you always want is to be able to hold more urine in your bladder so you don't leak. I'm someone that couldn't hold very much at all, and I would be leaking every day. But after my urology nurse saw my urodynamics test results, which that tests your bladder and your urethra and how they work together and how they perform in holding and storing urine, and then she recommended Botox, thought I might need it. And oh, am I glad that she recommended that it's been the best thing. Oh, I love it. I have less leaking, I can drink more water, I love water, and I don't have to worry about leaking. This is because I have an overactive bladder. I spasm in my bladder, which means I spasm leaks and I leak sometimes. What the Botox does is it relaxes the muscles, so it becomes less active and you're able to hold more urine before you leak again. The thing about Botox in the bladder is that it doesn't last forever, so it means you have to keep going back to get it. So we found with me, I need to get it every 5 months. Now in the lead up to the treatment, I have to make sure I don't have any UTIs and do a urine check that's all good. And I'm all good. And then I head off to Melbourne and get my Botox done. Ready, waiting to go in. I'm there in my gown. At least the hat's red. Yeah, so soon I'm going in. The nurse that I was hoping to see is still here. Oh. She was in the morning. So I asked the other nurses to say hello to her. I think it's the right nurse. I just said it was the nurse that we talked about Melbourne Football Club, and she had family that did it and was players and stuff. So yeah, her name's Jane, so now I know.
Tell someone if you're one.
What?
You want a drink?
Do you have a lot of drink now? I'll have a drink.
Sounds like you've had some already.
We don't make friends with stuff. We make friends with chicken, but not salad. Chicken's yummy. We make friends with bowls of pasta.
No.
Yeah, bowls of pasta.
No pasta. No McDonald's.
Why?
Fat diet.
Yeah, I'm on diet. I don't want to be on a diet. I'm out! So I survived. I had my Botox. Now I'm exhausted and ready to head back home. The procedure is a simple one, and it's usually performed in a clinic or a hospital. And the Botox, it's injected into the muscles of the bladder. And your doctor uses a cystoscope. This is a fine tube containing a tiny camera that enables doctors to see inside the bladder. Your doctor will inject tiny amounts of Botox in the muscles of your bladder. The whole procedure should be over in about 30 minutes, and most people tolerate it well. There shouldn't be any pain. And once you're finished, your bladder is emptied and then you're discharged to go home. I remember when I woke up the last time from the procedure, I felt drunk and I was very chatty. I kept chatting the nurses' ears off and annoying the nurses. Some people can be awake for the procedure and then some have to go under. I'm someone that has to go under, and it's mainly because of my spasms, because they go crazy, and then when I go under, they're relaxed and they stop going crazy. After the procedure, you have to drink lots of water. That's because there might be a risk of getting UTI because you're getting foreign objects put inside you. And the water is to help flush all that bad stuff out. Sometimes you may get given a course of antibiotics to help. And also your urine might be bloodstained for 24 to 48 hours, but then it'll be fine. It doesn't start working straight away. It takes a few days to 2 weeks to start working, and then it lasts for a different amount for everybody. Botox in my bladder is the thing that works for me, and I'm so grateful for it. I love it. So if you're leaking or you have problems with your bladder, I recommend asking your doctor about it and see if it could possibly help you, because it definitely helped me. And if you liked this video, click that thumbs up. If you want to see more videos, click subscribe, and I'll see you in the next video.